HIV is a sexually transmitted disease. It is a viral infection that unfortunately can affect you for life. And if you acquire this disease, if not treated and managed appropriately and quickly, it can lead to a compromised immune system and other invasive diseases that could result in death. The symptoms for HIV can seem like the flu in the first 6 weeks or so after you acquire it. After exposure, you may have a cold-like symptoms including runny nose, fever, and chills. Often, within the first few months or so, or even in years, severe lymphadenopathy usually occurs. Lymphadenopathy is when your lymph nodes swell. So when you get a cold, sometimes you have them under your chin or along your neck, you may feel swelling or a nodule, and that could be a lymph node that is swollen. Later in the disease, you may experience weight loss, appetite changes, fatigue, and more generalized symptoms. Also, other infections may start to arise that you may not otherwise be at risk for. It is caused by a virus. It's something that we've known about since the 80s and have made great strides in treating it. It can be transmitted sexually through semen, a break in the skin, blood contact, or vaginal secretions. Anybody who does not use condoms or has high-risk sexual behaviors would be at risk, including having had multiple partners, as well as IV drug users or those who share needles are also at risk. A simple screening test is done to detect antibodies in the blood. Depending on the results, follow-up tests can be run. There are also over-the-counter oral swabs that you can do. The results are similar to a pregnancy test. You can get them from your local drugstore. If you test positive on an at-home oral swab, you can see your primary doctor or contact our offices to get tested again. The Centers for Disease Control and Prevention's latest recommendations is that individuals aged 13 to 64 get tested at least once in their lifetime. And if you have risk factors, you should get tested more frequently, at least every year. HIV is very manageable, like diabetes or hypertension, but even more so. It's maybe 1 or 2 pills a day for life. You may need to see a doctor once every 6 months. Once you get it under control, you can still maintain a healthy sexual life, full physical activity, and you can go about doing the things you enjoy. Outcomes are poor when people don't get tested and when necessary, treated. The right doctor may not be the one everybody recommends. It is important to find a provider who you can talk openly and honestly about personal issues and concerns. A provider you feel you can trust and that they are going to do what's right for you. Should you choose North Oaks, we'd be glad to help you.